Hello everyone, my name is Andrew Scheim. I'm a licensed massage therapist utilizing a wide variety of bodywork modalities. Today we're going to demonstrate 3 simple techniques that enhance the use of the rapid release machine. The rapid release is excellent for scar tissue, adhesions, and releasing connective tissue. So the 3 techniques we're going to show today, the first one is a flexation technique, a neuroflexation technique. The second technique we call squeeze release, and the third technique is a neuromuscular resistance technique. So enjoy the video and thank you for watching.
In this next segment, we have the squeeze release technique. The client is using a racquetball to assist with the squeeze release. For the legs, the client can just squeeze their glutes and legs voluntarily. And the client just continues the squeeze release, and then we're going to apply the rapid release, the larger head to the upper arm here. And once again, the client just continues to squeeze release. They don't have to overdo it, just engage, release, engage, release. And when we move on down to the lower arm, it's a very bony area, so we're going to use the silicone coated head. And this is excellent once again for bony areas. Once again, this all depends on the build of the client. And the client just continues to squeeze, release, squeeze, release. Applying the squeeze release technique to the legs, we ask the client to flex their glutes and their legs at the same time. Squeeze, release, nice and gentle, nice rhythm. And then we apply either the large head of the machine, or we can once again apply the side of the machine for large muscle groups. Just squeeze the glutes and the legs at the same time. In this next segment, we're using a simple neuromuscular resistance technique. Ordinarily, you would have a client stretch a muscle to where they felt pain and then apply a gentle resistance for 2 or 3 seconds and recheck. In this case, we're just going to do the same process but apply the rapid release. Once we establish the resistance, we're going to apply the rapid release. You can stretch the joint in either direction based on comfort of the client. In this case, we're using the silicone head. Experiment with whichever head works best for releasing that tension point. This is excellent for neuromuscular work, for very stubborn patterns that are difficult to release. Once again, you want to just locate the tension point by stretching the muscle, loading it up, and applying the rapid release. This will accelerate typical neuromuscular work. In this sequence, we have our client doing a simple stretch release. Do not have the client hyperextend, just a relaxed stretch release. We're applying the big head to the IT band, and you could also, for all large muscle groups, use the side of the machine. Let's have the client just gently stretch, release, stretch, release. When we come on down to the attachments around the knee, we're going to use the silicone coated head, and that will protect the bony area. Just stretch, release, don't hyperextend. Very simple. Once again, the side of the machine for the large muscle groups or the big head. The stretch release for the lower back is a simple yoga stretch. Just have the client come up, sufficient for the engagement of the muscle groups. Have them go slow and rest when they come down, and have them arch their head back the best they can as they come up. As they go up and down, you can feel where the tension points are and work that lower back, the ilium. You can use the silicone tip for the ilium, iliac crest. Once again, just a gentle stretch, slow, have them rest when they come down. You don't want them to overstretch or go too. Some clients will tend to want to go too fast. Just guide them to a nice, gentle rhythm. For all connective tissue, hydration is incredibly important, and we recommend an excellent product called Blue Z Water. We'll post a link below. You want the connective tissue to be nourished and supple.